The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Today on Meet the Doctor, my guest is Dr. Kenneth Francis. He's a plastic surgeon in New York City. Welcome to the show.
Thank you, Eva. It's a pleasure to be here, and thank you for having me.
It's a beautiful summer day in New York, and I'm here doing my favorite thing, which is learning about doctors and helping patients get to know doctors better. So we're excited to hear your story. Let's start with, tell us about yourself.
Where should I begin? From date of birth?
I was born.
No, the most important parts about me are that, more so than being a plastic surgeon, actually, is that I'm a dad of 4 boys. No longer boys, they're men, they're fully grown and self-sufficient, but I take the greatest pride in that part of my life. And I've been a plastic surgeon for 29 years now, and in the blink of an eye, it seems to have passed, even though there have been so many different journeys and experiences with patients and different types of surgery and phenomenal results and some complications that are inevitable in anyone's practice, all of which have led me to become, I think, a better person. I enjoy practicing plastic surgery. I enjoy the patient contact and the smile on the face of a patient when they come back and say, "You've changed my life." And I've actually had that experience within the last week. And specifically on it, this was a breast reduction patient who was bringing her sister in for her breast reduction. And she said, "That was the best thing I've ever done in my life." And I said, "Well, can you write a review on RealCell for me then?"
That was the right way to respond.
Right response, right?
We've trained you so well.
No, I'm sorry.
5 years working on the training doctors to ask the question, "Can you write a review?" So you kind of just made my day with that.
Good. Yes, the message has finally gotten through, Eva. But no, in all seriousness, it touches your heart, and that's why we do what we do, is to improve patients' self-images, and that makes me feel better.
So have you always been in New York City? Is your office in the city or is it somewhere else?
My practice has always been in the city with satellite offices throughout Queens and Long Island. Currently, I have a satellite office in Belmore, Long Island. Nothing in the Queens area. But I used to participate at a number of the community hospitals in Queens, and I've since retracted those, or the hospitals have closed for various economic reasons. So primarily, I'm in Manhattan at one satellite office, which I've had for about 11 years. And I was previously with another plastic surgeon in the city here. We were together for about 11 years. And then I struck out on my own and have been in that practice for just about 18.
Are you commuting around a lot, or do you tend to go to the same place every day?
I used to commute around a lot when I had all of those facilities in Queens, plus my Manhattan hospitals. Being mostly a cosmetic surgeon now, cosmetic plastic surgeon, there's very little need for use of hospitals, and they're prohibitively expensive for patients to have cosmetic surgery done in. So I've got my own operating room, which makes it very discreet for the patients. It's certainly a lot more within their budgets to have that done at my facility in the Manhattan office.
So that's where you go most days?
Yeah, that's where I go 2 days, and then 1/2 a day in the satellite.
So do you live near one of the offices?
I live closer to the Long Island office, yes. So I commute into the city, but I'm able to design my own schedule. So I'll operate at 6 in the morning, to miss the morning rush hour traffic, and I'll usually leave the office at 7 at night and miss the evening rush hour. So it's not as grueling as it would
No.
seem to be.
What do you like to do or listen to while you're going between the two? Right? Do you like podcasts?
Real Self podcasts, of
Oh,
course.
very funny.
No, I have only listened to podcasts that have been forwarded to me mostly by one of my brothers who's a little bit of a conspiracy theorist. So he likes conspiracy podcasts. Other than that, I don't really listen to podcasts. Would rather listen to music and relax as I'm driving in.
Mm-hmm. Yeah, I think you can choose things that make you stressed out to listen to, or you can choose things that allow you to think. And my mom used to call this windshield time. Like, what do you do with your windshield time?
Mm-hmm.
And it can really have a big impact on your day.
It can. And for no specific reason have I not gotten into podcasts other than maybe my ignorance about them, if you will. I don't really even know how to pull one up, to be honest with you. I mean, I guess I know how to go to YouTube and can probably find them there, but other than that, I wouldn't even know how to start accessing.
Most people actually do find them on YouTube.
Uh-huh. Okay, good. So I'm in the ballpark.
Yeah. And then they could find this one on YouTube.
Great.
If someone, we hope, puts your name into YouTube, that they might find this and get to know you better. So I have some favorite questions that I like to ask, and I've discovered after, 60 or 70 doctor interviews that when I asked the question, how did you know you were going to become a doctor? Either they knew it from the beginning, like they knew from a very young age, I'm going to be a doctor, or something happened. They were on a different path and something happened and they switched all of a sudden. So now that I've set it up too much, how did you know?
You set it up perfectly. And I do have some thoughts about this. I fit into the category of, I've known ever since I was a small child that I was going to be a doctor. Now, I don't know if that was self-motivated. It's more likely because it was driven by my grandparents who were blue-collar workers. My grandfather worked for the sanitation department, and they wanted a better life for me. And, I fared well. I guess I reached all of my milestones early and whatnot as a child, and that was recognized. And
that was here in New York somewhere?
That was on Staten Island.
Oh.
Yes. I'm an original Staten Islander.
So am I.
Are you really?
Sort of, yeah.
That's great. So I don't know if I can say it was self-motivated. And I also can't say that it was forced upon me by them, because I did have more of a penchant for sciences and math, all of which sort of lead you more in the direction of becoming a physician. And I've always enjoyed helping people, even if it was as a young child, helping my friends do things and doing things with people and for people. So I've always had enjoyment in doing that. And I think the two things just eventually married and said, you've got to continue that track and become a doctor.
Mm-hmm. And so where did you go off to college then?
So from Staten Island, I actually lived in Tehran, Iran for a year just before the hostage crisis. My dad, who worked for Western Electric, had taken a transfer over there just to have a different experience. And I think about them doing that with 4 young boys. I come from a family of 4 boys as well.
And you all went on this?
We're all a year apart. And we were 6th grade through 9th grade. So I think back and imagine being a young family and traveling to the Middle East to live for a year. It's a pretty daunting
It's remarkable
prospect, but they pulled it off, and we lived there for a year. Of course, we were not happy about it, being young teenagers and 10, 11, 12, 13-year-olds. So then we returned after a year just before the hostage crisis, just by fortune, by no other reason. In fact, we were supposed to stay for another year and a half, and we ended up moving back. So I came back. We lived in New Jersey at that point, and I went to school at Wake Forest for both undergraduate and medical school, and loved it. North Carolina is a beautiful state.
Yeah. So medical school, and then tell us how you got back to New York.
Well, there's a match program, as you probably know, coming out of medical school to get into residency. And I matched at the Cornell surgery program here. So I ended up coming back to New York. And once you get into residency, you make all sorts of connections that sometimes anchor you to that geography. So I ended up making contacts of that nature, and one of which was with my former partner, who offered me to come into his practice after I finished my residency. So that's how I ended up here in New York City.
It's really incredible that you did that. It never feels like, when I ask that, and then you went here, and then you went here. Someone always surprises me with something completely out of left field, and then we moved to Iran.
You should see the surprise on some of my Persian patients' faces when I speak a little bit of Farsi to them.
And so you still remember the Farsi from living there?
I'm certainly not fluent, but, I can do all the salutations and things like that. And I can tell you how to get around in a taxi, so...
Valuable
when
skill.
I get a Persian taxi driver here, it sometimes comes in handy.
Wow.
Yeah.
At some point you decided, well, maybe it just happened to you, that you were going to get married and have kids, and you ended up with 4 boys. No, you were one of 4 boys. You
Both.
Also have 4 boys?
Yes, and I also have 4 boys.
Wow.
Yes.
I wonder what the odds are of that.
I don't know. I couldn't tell you. I don't know if there are statistics on that. There must be. But my family is very strongly XY. There are only, amongst my nieces and nephews, only 2 out of 10 are girls, and they're twins.
It's very unusual.
Yeah.
The boys, you mentioned earlier, they're all launched. You've gotten them successfully out of your house.
Almost. The last one who's only 24, so he's still working through some things.
He get a pass till he's off your health insurance.
He gets a pass, till 26. So he's still going through the grad school process now to become a teacher, and then he'll be out on his own.
He sounds brave.
He is brave. He's a very unique young man. He doesn't care what other people think or say about him. He just does what he feels he should do, which is great.
Yeah. What is this generation called? Is he a Zoomer? I don't even know. I stopped keeping track.
Well, he's not a millennial. He's too young for millennial. What came after that? Z?
Z?
Millennials
and
are
then
Y,
there's Zoomer.
right? I think he's Z. Yeah.
I guess I'll have to look it up. So now that they're kind of out of the house, are you finding yourself with more free time or not so much?
No, I'm finding myself with less free time.
Less?
Yeah, because I'm getting involved in other things that I wouldn't have gotten involved in if they were still around.
And I should have said, what are you filling up this newfound free time with to keep yourself busy?
Too many things. I feel like I have so many balls in the air right now, and none of them specifically related to plastic surgery, other than a little business venture I'm getting into with another plastic surgery friend of mine that has to do with, and that is not plastic surgery specific. It's medicine, something in medicine. But that's one thing, and then a whole bunch of other endeavors that I'm getting into outside of the medical field.
That are still under NDA and you're not going to share them?
Yes.
Okay. We're going to have to come back and find out what you're talking about later. I can tell when when somebody's stonewalling. It's all right. So We haven't talked much about your approach to patients, so I want to go there for a minute. When someone comes to see you for the first time, what can they expect?
Depends on my mood for the day.
Which podcast have you listened to that morning?
Yeah, right. Or what was on the radio.
Yeah.
I try to listen to classical music to sort of set the tone for the day when I'm coming in.
Do you have a favorite?
Yes, I do. Claude Debussy is my favorite. Yes. But anyway, it's funny that my office manager sometimes recognizes if I'm down and she'll say, "Smile when you go in there." Meanwhile, I always have a smile on my face when I'm greeting patients because they've chosen to come and see me, and they've taken their time in their busy days to come and find something out, get some information from me. So I feel like I'm always pleasant to patients, and I try to be extremely patient and answer all their questions and give them as much information as I can. And I think I achieve that. At least I see that in the reviews that I get, most of the reviews that I get.
Is there a procedure or a set of procedures that you're known for?
There are. At one point in my career, I was known as King Tuck by my staff because I was doing so many abdominoplasty procedures that they dubbed me King Tuck. And then later, maybe 15 years ago or so, I transitioned to Buttman because I was one of the first in New York City to start doing fat transfer buttock augmentations, the Brazilian butt lift. And it sort of happened just as a coincidence. My anesthesiologist at the time had seen someone else do one in another office, and he said, "Why don't you start doing these here? It's going to be a pop culture phenomenon."
Boy, was he onto something.
He was foresightful at the least. So anyway, I started doing them in around 2005. And that part of my practice really took off, and I was actually fearful that I was being pushed into a niche of just being the BBL guy, which, is not the most morally rewarding operation in the world. It's not a reconstruction of a breast cancer or something. But if we're not doing it safely as certified physicians and plastic surgeons, you can bet that someone is going to be doing it unsafely in a back alley or in New Jersey and putting someone in their basement. So in that regard, it sat well with me. And it even became so busy to the point that my staff and my fiance at the time both independently and simultaneously bought me a T-shirt with the Batman insignia on it, but saying Buttman.
No.
Yeah. It was fun. It was fun and funny. So for, I guess, the last 15 years, that's been the majority of my surgical procedures. I still do everything: facial work, breast work, body work, even some reconstructive work, although about 95% of my practice is cosmetic right now.
So people still finding you for the butt?
They are, but pop culture has started to swing in the opposite direction as a certain celebrity family group has started to downsize their buttocks.
I think about a year ago, I started seeing the BBL reversal start to trend. Are you seeing that happen?
Yes, they're starting to come in. And that's an interesting concern because 25 years or so ago, we learned as a plastic surgery community that it's a little risky to liposuction the butt, which is how you would reduce a Brazilian butt lift. The reason being because it deflates and sometimes looks like a deflated balloon. And the majority, I can't speak for all plastic surgeons, but all of the plastic surgeons that I know stopped doing liposuction of the buttocks for that reason. And now we fast forward 25 years and they're coming back to have their BBLs reversed. And I've done a number of them, but at least we know now to be conservative and not try to suction out all of the fat. And I inform patients that this may be a multiple stage thing where you have to do a small conservative amount, allow your skin to shrink. And we do have some skin tightening technologies that can help us out with this now that we did not have 25 years ago, like radiofrequency treatments, laser liposuction treatments, technologies of that nature. So it's better than it was 25 years ago, but we make sure that we do it in a conservative fashion.
It's hard to talk about BBL without asking a safety question. So one thing I've seen in recent years is that the plastic surgeons as a group, as a profession, did a really nice job banding together and figuring out what was safe and then getting the message out. I think maybe the best example of that I've seen in my career. And since you've been doing them since 2005, I imagine you've seen some not so great results come through the door that needed help.
Absolutely. And it's not even the not so great results. It's the deaths that have resulted. Florida, Miami has been the hot spot for that, as you probably know. And over the stretch of the past 3 years, I think there have still been 14 deaths, despite the ASAPs and ASPS task forces having come out with recommendations. There was a short vacation for the first year or so after the society statements were made about how to do it safely, where death numbers did drop significantly, but then there was another rise following that. But definitely the ASPS and ASAPs does need to be credited with investigating the causes for those deaths and coming out with avoidance strategies to prevent that in our entire society across the country. And I think it's been pretty effective, other than that little enclave of deaths in Florida. And there are a number of other reasons that extend beyond the actual anatomy and surgical technique. It's more of an overload of patients and doctors running different rooms at the same time with possibly less qualified other physicians doing the actual surgeries.
I think whether you're a patient or a doctor, it's very hard to understand what kind of person who claims to be a doctor, who claims to first do no harm, would set themselves up in this situation and just put people at risk every day. And then you start asking questions like, why isn't Florida doing anything about it? And how come this keeps happening? How are these places still in business?
That's a good point. And what they do actually is a couple of good points there. When they do get into trouble, they shut down their operations and they move to another facility and change the name of the corporation. And these are basically mills, plastic surgery mills, that are owned and managed by business people and not physicians. And the other thing is, within any profession, regardless of how moral or ethical it is, there are some bad players. I mean, look at the Catholic Church issues.
Fair point.
So yeah, even those with the alleged highest morals have some immoral people within their ranks.
When people ask you, how do I safely assess whether this is somewhere I should go or not, is there any simple answer that you can give them other than beyond being board certified?
Yeah, there was one other point I wanted to make about your comment or your question. What is Florida doing about this? And they actually have taken action in Florida. The Department of Health issued an emergency rule last year about a year ago, actually, limiting the number of BBLs that can be done in a day, restricting BBLs to being done only with ultrasound guidance of the cannula that injects the fat to make sure you're not in muscle or in a blood vessel or something that could be injurious. So they have taken action. That was an emergency ruling, and it was the first time ever that a Department of Health had dictated what and how a procedure should be done. They were supposed to come out with a final ruling after that 90-day emergency rule, and this is all now going through the legislative process in Florida. And I know that because actually I do some work in Florida currently.
You do?
Yeah. I have a friend who has a practice in Palm Beach Gardens, and I've started going down once a month to do some work with him in his office.
I bet that's a nice change.
It is, but it gets a little cumbersome with traveling every month to go down there. And my initial goal was to eventually transition to Florida into retirement and phasing out.
You're still planning to do that?
Possibly. I'm not 100% sure because the pandemic threw a whole wrench into that.
When they tell you can't work, you have to start thinking about where can I work?
And now the economic downturn has changed things a bit in terms of my timeline. But there was another thing that you mentioned, and I skipped over it to the Florida interventions.
I think I asked, aside from being board certified.
Oh, what would I recommend to patients to identify a safe surgeon?
Yeah.
Obviously, board certification is number one. Not to say that no deaths have occurred at the hands of a board certified plastic surgeon, because they have. But that would be the number one starting point, because we're put through a fairly rigorous and structured certification process that has to be maintained. And we're in a 10-year cycle of recertification, whereby every year certain activities have to be done and submitted to the board for you to continue your certification. So that would be the number one place to start. Another good thing to look at is hospital privileging. If your plastic surgeon is not hospital privileged, then you have to buyer beware, because hospitals also require certification and usually a certain number of procedures to be done annually. So
I was going to say, prove it. You have to prove it.
Yeah, exactly. Those are the two primary things. And then, you can look at reviews of other patients and get a feel for competency there. Obviously, the notoriety of hospitals that doctors are privileged at, because some hospitals only accept the highest level physicians. Those would be the primary things to look for, I think.
I like to, when people ask me, I don't know every doctor, contrary to popular opinion. There are doctors I don't know yet. I also call out photos, reviews. Can you have a second consultation if you ask for one? That's
in my practice? This is what you recommend to patients.
Yeah.
Are there physicians that would not entertain that?
Well, I guess
there are.
If they wouldn't, that would be a red flag.
Yeah, absolutely.
A good surgeon would want you to make the best decision. And if you have more questions, you should be able to ask them.
Yeah, absolutely. And good point. I can't say
not seeing the surgeon before you have surgery. That's another thing that they do in Florida.
That is another red flag in the Florida pod there. Mm-hmm.
Yeah, it's kind of a big deal.
Mm-hmm.
Yeah.
Well, there was a write-up that described some of the depositions of the physicians that were involved in those deaths, and one of them was questioned about a particular patient, and he had no idea who the patient was.
Couldn't even remember who they were?
Couldn't remember who it was, and she was his 7th or 8th case of the day. Yes.
And it's a surgery that takes many hours, right?
2.5 usually, yes, and can be more depending on the number of areas of liposuction that are being performed.
If it's roughly 3-hour surgery times 7.
Right. This is why they're running multiple rooms, and it's literally a factory.
Oh, that's so horrifying.
Mm-hmm.
I hope we see the end of that at some point. And then no more people are hurt. Okay, well, let's talk about you some more. How would your staff describe you?
My staff is pretty small, and I keep it that way for a reason. Financially, not because I want them to. I'm worried they're going to criticize me.
No, frugal is fine.
Which I don't know, they might. My office manager and I have a very love-hate relationship. We've been together for 16 years.
So when she hears this, she's not going to be upset
No.
by your description?
No.
Okay.
She knows. And she's always been told by our anesthesiologist, the gentleman I mentioned before, that she is my longest relationship, which is true, unfortunately. So the other staff members, I think, would describe me as down to earth, honest, and with good integrity. I think those would be the most frequently used descriptors. Because I'll tell a patient if I don't think something's going to work for them, I'll let them know.
Is that the part of your job that you wish you didn't have to do?
No, actually, I enjoy that part of the job because there are too many out there that will say, oh, yes, you can do it and it's going to be great, and it may not be so great. And so I think it's nice for the patients to hear, and I don't mind telling them that. I don't mind being straightforward and honest with them if that's my opinion about it.
What is the part of your job that you love to do the most?
I think meeting patients and just getting their story, because everyone has a story and everyone has a different story. I like stories, and especially as they relate to patients' personalities and characteristics and pathways to where they have landed. So I think that's the most favorite part of my job. The operating is fun too, but it's actually the meeting the patients and learning their stories.
If someone is coming to see you for the first time, what should they expect?
They should expect a homey, friendly atmosphere where they will not be treated as a number. They'll meet my very friendly front office staff and office manager. The office, although small, is welcoming. We have it set up more like a living room or TV room setting rather than a big fancy marble facility.
Not a Renaissance style.
No Amalfi Coast or Renaissance appearance.
I haven't seen that in a long time, but I used to see that in offices pretty regularly.
Yeah. So I think they would expect to be greeted warmly, treated humanistically, and guided through the process.
If someone wants to learn more about you, what's the best place online to do that? Where would you like them to go first?
My website is probably the most informative in terms of my accomplishments. Real Self also has my bio on there, but I think it's not as extensive as the website. Instagram is a good source because a picture tells 1,000 words, as the saying goes. And there are many pictures on there of me outside of the operating facility and plastic surgery. There are some personal postings on there that I think give some indication as to who I am and what I am.
And what's your Instagram handle?
It's Kenneth Francis, MD.
We'll check it out.
Okay.
Thank you for sharing yourself with us today.
Thank you, Eva. It's been a pleasure.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.